Anna, it's so nice to meet you. Thanks for having me in today. How you doing?
I'm so sorry. Just 1 second. I need to finish this message off to my
Oh, sure,
partner.
of course. Yep, take your time. No worries.
Okay, sorry. I just need to figure out daycare pickup today.
Oh, of course. Is this still an okay time? We
It
had scheduled.
is.
Okay,
Yes,
okay,
just
great.
trying to fit everything into the day.
Of course. Yeah, I can sense just seeing your waiting room out there how bonkers everything is. And I'm so grateful that you squeezed me into your schedule for this next 15 minutes. Do you still have 15 minutes or should we make it a little bit shorter?
15's great. Yeah, I have it blocked off in my calendar.
Okay, great. Well, just as a refresher, I'm Bevan. I'm from the Boston Public Health Department. And I set up some time on your schedule with Frank, your practice manager, to talk about this new initiative around harm reduction for folks who use drugs, which I know you know, especially being near Boston Medical Center, is quite an issue for our city right now. And looking into some ways we can support them realistically with some harm reduction. And also ways that I can support you and offer you tools so that your days are less stressful, not more stressful. How does that sound? Does that feel like something that's relevant to you and that you'd like to talk about?
Yeah, that sounds good. We're not in trouble or anything, right? Our clinic isn't
Absolutely
in
not.
trouble. Okay.
Nope. I'm actually meeting with everyone who has prescribing authority and sees, patients that aren't pediatric or geriatric in this zip code just to talk about this initiative. So I've seen your colleagues in this clinic. I've seen, colleagues on the other end of town. So definitely not in trouble at all. And if
Okay.
you were in trouble, I wouldn't know. So um, so what we're here to talk about again is just how do we support these folks who really have a lot of different needs as they use drugs and are especially vulnerable to overdose. So I wanted to ask you, what are you seeing in terms of patients who are coming in who might be using drugs? Are you able to determine when they may have a use disorder?
Yeah, I'm so lucky here at this clinic. My patients and I have such strong relationships. I've known them for so long. They definitely tell me when something's going on or if they need help, and I trust them to do that.
Yeah, that's awesome. I don't often hear that. So that's a really beautiful thing that folks, I don't hear clinicians often say that they have those kinds of solid relationships as a first response to that question. So hopefully you can feel good about that. So you feel that your patients come to you when they have an issue. What about folks who may just in general, not because of anything to do with your relationship, but just the stigma that comes with using drugs? What about folks who may keep it a little closer to their chest? Are you doing any sorts of screening to see if folks may be actively using?
I never really thought of that because I just feel like all have such a great relationship and they can be
Mm,
open with me. Um,
mm,
I hear about stigma with a lot of other clinicians, but I never really felt like that was something that affected my patients and myself.
mm. Yeah, what's really something that we've been learning by looking at more evidence and qualitative interviews is that a lot of patients have had other interactions with other healthcare professionals before you that have been stigmatizing, where they felt shut down, especially if they are marginalized folks who don't see themselves reflected in the clinician with whom they're speaking. So again, you may have the best relationship with them possible, but if they've had experiences where they've, been exposed to stigma from a clinician in the past, we want to make sure we're not missing those folks, right? Because as if I can show you this detailing aid right here, there's a graph that shows how overdoses are still high here in Boston. So we want to make sure we're not letting anyone fall through the cracks. And that way we're doing it systematically. So I'm wondering if you've ever heard of the TAPS tool. Um, have you ever used that before?
I've never used it, but I have heard of it as I've read through literature and things like that. But I haven't used it myself.
It's a quick and easy screening tool. You can hand the patient your phone. They can pull it up on their own phone. There's a QR code here. It takes about 2 minutes. And they
Mm.
basically can just go through with, the comfort of you as a trusting professional in their sphere, physically in their sphere. And they can, share what their use has looked like. And then the tool will indicate whether they are at risk and what you can do from that point forward. The other thing that I think might fit you a little better, because you seem to have this relational aspect that's so meaningful to you, is we have a scripting tool to ask patients specific questions that get them talking. So you can initiate the conversation versus waiting for them to initiate, so that you make sure that by using this scripting tool, you're dotting your I's and crossing your T's and no one's slipping through. Would that be of interest to you?
Definitely, and I'm realizing as we're talking, I mean, I don't wanna offend anyone with the questions that I'm asking about substance use or make it seem like I'm making any assumptions. Do you
Mhm.
think that the scripting tools you have don't do that? Is that
Oh, absolutely not. They're
okay,
very open-ended questions. They
okay.
very much leave it open to the patients to self-identify in whatever ways they feel comfortable with. I think between these two tools, if you try using one or the other, or if you end up having the time, you could do both. I know that's unrealistic, but one thing you could do is have your MA or your PA or whoever gets them, checked in and gets their vitals done. While they're getting their vitals, they can go ahead and use the TAPS tools, so that your MA or PA or your nurse or whomever it may be can say, this person is at high risk. You'll want to have to use the scripting tool with them when they walk in. So that could be a nice 1-2 approach if you'd like. But I want to be conscientious of time. We're coming up on 15 minutes. And, I just want to make sure that you have some breathing room, especially with a crazy day. How would you feel about me leaving you this content, and then sending you an email if you're comfortable with email to follow up and see? You can try the TAPS tool, just pretend you're a patient, fill it out as yourself, see how it feels usability wise. Take a look at this really simple scripting tool. And if you look at those both in the next couple weeks, I could email you and just see, what was your take? Do you feel like they're tools that could benefit you? And if it's a yes, we can set up some time to figure out how to incorporate them into your workflow. How does that sound?
Yeah, that sounds good. Can you send me a link to the TAPS tool so I can have my
Absolutely.
MAs put it right on our iPad?
Yep, absolutely. Okay, so you're
Yeah.
already thinking about implementation. That's
I
great.
am. Yeah, it
Okay,
it seems
okay.
like it will definitely help, you know, with my visits and making them more efficient.
Okay,
And
that's great.
I do wanna make sure I'm providing the best care to my patients and meeting their needs.
I can tell that from the very first exchange we had. So it's really been lovely to chat with you. Okay, let me get out of your hair. I'm just going to wrap up really quick. So we talked about, sort of the relationship building piece being the strongest thing you feel really, really good about with your patients who may be using substances, or really all of your patients. And then we talked about these two tools that could work in harmony together to help make sure you're using a bit more of a systematic and standardized approach to sort of catching those folks who may need that extra care and extra attention, and sort of seeing how you can support them. What we'll do is I will send you an email. I will include the link to both of these tools as we discussed. And I will follow up. And it sounds like you're really raring to think about this and raring to go. How about I follow up by the end of the week and just see what you thought? It shouldn't take you more than 2 or 3 minutes to look at both of these. And then you can tell me if you're ready for me to set up another meeting with Frank to sit down with your MAs, talk about getting it integrated into check-in iPads and taking it from there. How does that sound?
That sounds great, and I definitely wanna do a little more research on my own too. If you have any
Sure.
other reading on the TAPS
Absolutely
tool
do.
and the scripting tool, that would be great.
Yep, I have a NAGEM article that will
Great,
back up both of them. So I'd be happy to send that along as well. All right.
thanks.
Well, thank you so much, Anna, for squeezing me in. And I hope everything goes well with pickup this afternoon. And I really appreciate your time.
Thank you, I think we figured it out. Alright, take
Okay, great.
care,
Thank
bye-bye.
you.